And we're live.
Hi, Hannah.
Every time I say to myself, don't start touching your face or your head or something like that. And every time it goes live, I'm just busy doing a last minute adjustment or something. Here I am. This is just me as I am.
Welcome back. I like you as you are, and I'm glad that we're here as we are. It's been
Yes,
a while, and I'm so excited. I'm so excited that we're back doing these.
me too. I'm looking forward to it, especially tonight because we're talking about intimate aesthetics.
Yes.
Something that is not a familiar thing to me. Did not
No.
grow up with that on my radar.
I don't think many women have. This is something I'm also really excited to talk about. And I think one of the things I hear often when I'm in the exam room with the patient is our apologies. Maybe my patient didn't get to wax or shave or their legs or their vulva. And I always say, don't worry, I'm not concerned because I'm not concerned, but I'm not your partner. I'm not her partner. I'm not her husband, her boyfriend, girlfriend, whomever. And so I'm not her. So aesthetics is important, and it's important to the individual and also to the relationship. And so, yeah, something that maybe we didn't grow up with, we haven't heard about, but it's out there and people are doing it. Women are doing it and enjoying it and having full lives, just making sure that they're taking care of their nether regions.
You know what it makes me think of? Just during COVID, when I wasn't having that many house guests, like the level of filth I'm willing to get to in my house. But when people are coming, I'm like, nope, we got to scrub everything.
Base boards, and that's what you're doing. Base boards.
Right, so that you can, have a nice, clean, welcoming environment.
But do you know what? It's more than just that. It's also increasing your own awareness of who you are, increasing your empowering you as a woman. Many women, after they have some of these procedures done, say that they feel more sexual or that they enjoy sex more. You and I personally talked about these things offline. I feel like there's a fine line that you and I maybe run and having these discussions. But you know what? Why not? Why not? Because we as women are having them in our own living rooms with our friends or on the phones with our girlfriends, with our significant others. So why not talk about it here and really lay it out and we have a real discussion about it. So what is intimate aesthetics? Well, it's really aesthetics for your intimate areas. And so that includes your vulva, your vagina. And there are many procedures that can be done to just improve that area, the texture of the skin in the area, decrease inflammation, redness, ingrown hairs. And so a few of these things are similar to what you do for your face that you can do in your intimate areas.
So let's break some things down. So if someone comes to the website, then they're going to see options for a VSteam or Vajacial. Can you break down what those services are?
Yes. Let's talk about Vajacial first.
Okay.
So Vajacial is a facial for your vajayjay. It's easiest just to think about it like that. So we just go back in and talking about the skin around the vulva and what can happen. We oftentimes as women like to remove hair there. And so that skin is very sensitive and hair removing can be cause a lot of inflammation and also can be painful. And so that can cause micro trauma to the skin, increasing our risk of having redness, bumps, irritation, ingrown hairs, discoloration because of the repetitiveness in which we go get our Brazilians or bikinis. And so, you coming in to see me for your exam or whatever, maybe I don't mind it, but maybe you mind it. Maybe it makes you a little bit more cautious when you're with your partner. And so then that's an issue. And there are ways to take care of that. And so with certain treatments, we have Vajacials. Where we address those issues with the skin, the redness, the irritation, ingrown hairs. And it can take a step forward in women who actually have dermatological issues in their vulvar area, those women who have contact dermatitis, women who maybe have lichen sclerosis, women who have recurrent yeast infections in which they have a lot of chafing and itching, and that's caused discoloration. And so those things can be addressed during a vajacial.
Well, to me, the pain and discomfort outweighs the looks, but I guess ultimately, like in a dream world, you would have the benefit of neither being a problem. So I love the idea that it can address from either angle.
It can address from either angle. And it's also, just like facials are relaxing, it can also be a relaxing time. The time just for upkeep, best done after some type of hair removal treatment. So if you're getting regular wax, you can have a lot of irritation, as we know, after a wax. Be careful where you're going when you get those done. If you're getting laser hair removal, you can still have irritation in that area. And so having a nice calming treatment can actually be relaxing. And again, it's just a way to relieve stress, the same way you get your monthly mani-pedi, or every 2 weeks, however often you go, your monthly massage, your monthly facial, you can get your monthly vajacial too.
And so should people avoid coming in if it's during menstruation?
During menstruation, you would want to avoid coming in to have that done when you have an active vaginal infection, like an active yeast infection, active BV infection. You would not want to get the procedure done or get the treatment done.
And something that we were talking about offline too is the care about the ingredients used. And for me, that's one of the big benefits for people coming to you, is because you are selective and aware of what you're putting on. So many times, if you go to just any old place, there's not consideration about the sourcing and the ingredients list of items, care products.
You're right. Even though we are with the vajacials concentrating on the outside of the vagina, that's still very sensitive skin. And we want to be mindful of what goes on the outside in case anything gets on the inside. That's extremely insensitive area. We don't want to mess up with the vaginal pH. And then going into just talking about women who may have dermatological issues, it's very important that we're careful with what materials we use and where they're sourced. And then we also have to consider other medical problems that can be impacted by use of certain synthetic products. And so, we're very, very mindful of what we use, how much we use, and then how often we would use it. Very mindful of that. You're correct.
And then that leads us to VSteam.
VSteam. Yeah, VSteam is also known as vaginal steaming, or yoni steaming. That's another term that's been associated with the treatment. And it is an integrative health treatment that uses the benefit of steam to relax the vagina, relax the muscles of the vagina too. And it also is really beneficial in for many other conditions. There are some who believe that V-steaming can be really good for women who have menstrual issues. V-steaming can help to reduce symptoms of menstruation, cramping, bloating, even heavy bleeding. There's some literature that does support that. Nevertheless, whichever side of the coin that you're on, done in a safe way, V-steaming can also be a relaxing treatment, and also very good for the vulvar skin. Steam is good for skin to open up the pores of the skin, especially in those women who have a lot of irritation after treatments for hair removal, and those who are more prone to having ingrown hairs.
And it seems to me like, I've never done one, but I'm just imagining when you're in the shower, even if the shower gets steamy, that's not exactly reaching that area that, oftentimes it's coming from above. So it's not like actually direct steam to that area.
In the shower, no, but in the process of having V-steam,
Right. So you wouldn't be able to manufacture that benefit without going somewhere that did
exactly.
this.
Yeah, exactly. Yoni steaming, V-steaming has been done in other countries for centuries. And so it's not something that is new. I think invoking some of these other treatments into Western style medicine does have its benefits. And so that is something that we've brought to our practice.
And I love that. Can you say a little bit about that. These are new offerings, both to EvoScient, but also to a typical Western medicine practice. So can you say a little bit about what drew you to bring those in?
I think it is listening to women and also just having an open mind, not being closed off to my own thought and listening to the experience of others, and also being a bit myself experiencing new things. That's what's made me want to bring that upon the procedures that we offer, the treatments that we offer, because there's really multiple ways to peel the apple, and so the more experience that you gather, the more that you learn, the more that you see actually it does work. There is some benefit to it, and just the mere fact that we take care of ourselves has a good benefit, because during that process, we're releasing endorphins that do nothing but good for our bodies. And so this is a way to bring that in.
Mm-hmm. Yeah, I love that. There's also not a lot of opportunities for collective, unless you seek them out, I suppose, but like in the average American's life, it doesn't seem like there's a lot of, let me just speak for myself. In my life, I don't have enough, I crave more opportunity for being with women and getting in touch with that femininity, and relax and ease and all of that. So
Yeah.
it sounds like a really beautiful thing.
Yeah, I try to not only talk the talk, but walk the walk. So experience these procedures and treatments for myself too. And, really say what works. You and I have had our own experiences with some of these things. And so I think that being able to see it on the clinical end and also see it on the patient or client end gives me a bit more insight to be able to help suggest women. So I'm so excited about these next few talks that we have, because we have a lot that we're going to be getting into, more past these aesthetic procedures that we do, past the Vajacial and the VSteaming, going in to talk about estrogen pellet therapy, more about vaginal vitalization, vaginal rejuvenation with Diva, laser therapy, and O-shot also. So I think, there's a lot out there that's good for us women. There's a lot out there that can improve our lives. There's a lot out there that can improve our experiences in the bedroom. And that has just a positive impact on our day to day. There's nothing wrong with talking about it. There's nothing wrong with being open about it, open-minded to listen to suggestions and also experience too.
I love that. There's so much. If you want to see something that you haven't ever seen, you're going to have to do something that you've never done.
Yeah.
So there's so many times that we sit down for this conversation and I say, that wasn't on my radar when I was growing up, or like I never knew my mom or grandmother to do that. But that doesn't mean that it's not a right thing or a new development. Things are changing all the time, and us adapting to them for improvement is the name of the game. So
yeah, there doesn't mean there's not a benefit to it. Doesn't
right.
mean there's not a benefit to it.
Have you had so far any common questions that people have asked about these, or anything else that you'd want to add that you get asked often?
One of the questions we talked about the safety of the products for sensitive skin, and we at EvoScient use only products that are made for sensitive skin, and because it's a very sensitive area. Another question about the VSteam particular is, again, the safety with the fact that you are using steam. So in a VSteam, you're sitting on top of an apparatus that allows steam to go around your vulva and into your vagina. And so we at EvoScient have a special apparatus that we use that has a good distance between you and your skin to decrease the risk of any type of burn. Again, with VSteaming, that's something you would want to avoid during menstruation or if you're having an active infection. So those are the main questions that I get.
And so how about the length of each treatment? How long is the Vajacial?
Both are about 30 minutes, depending on the client, the patient. And, as far as financial costs, they're about the same that you would pay for a normal aesthetic procedure that you get on your face.
Oh, nice. Nice. So maybe spend a little less time on the toes.
Yeah.
Maybe skip the toes 1 month if you need to. So I'm just going to drop EvoScient's number right Oh, I can't do it. I'm dropping EvoScient's number so you can give a call. It's really hard, right? You guys see it. There's the number. Call for more information or to make your appointment. Thank you so much, Dr. Ojo. It's so nice to see you again. Thanks for being here, you guys.
Thanks.